रीनल फंक्शन टेस्ट चैप्टर नंबर 43। आज हम लोग समझेंगे कि रीनल फंक्शन टेस्ट क्या होता है यानी किडनी फंक्शन टेस्ट क्या होता है। इसमें हम लोग कौन कौन सा टेस्ट करते हैं और क्या पता चलता है इस टेस्ट से। तो चलिए शुरू करते हैं किडनी फंक्शन टेस्ट यानी कि रीनल फंक्शन टेस्ट। Kidneys performs many functions, namely maintenance of internal melee by excreting soluble waste products of metabolism, maintaining water balance, pH, electrolyte, and osmotic pressure. There are several tests for assessing the health of the kidneys. The implication of some of the commonly done tests will be described here. First is urine examination. यूरिन एग्जामिनेशन में पहला है स्पेसिफिक ग्रेविटी ऑफ यूरिन। नॉर्मली यूरिन स्पेसिफिक ग्रेविटी lies between 1006 to 1025, 1.006 to 1.025. If the urine specific gravity does not show significant difference between early morning urine and that passed during the day after taking water or food, it points to failure to concentrate urine, which is a function of distal tubule. सेकेंड जो है वो क्या है, बी नंबर, presence of albumin in urine. Detection of albumin in urine is abnormal and indicates damage to glomerulus, which may be due to hypertension, very low blood pressure, and glomerular on ephraitis. Glomerulonephritis, very low blood pressure। ये सब क्यों होता है, तो ड्यू टू हाइपरटेंशन, वेरी लो ब्लड प्रेशर एंड ग्लोमेरुलोनेफ्राइटिस, ये सब कारणों से। सेकेंड पॉइंट जो है ब्लड यूरिया एस्टिमेशन। तो यूरिया इज अ वेस्ट प्रोडक्ट ऑफ protein metabolism. Its level in blood depends upon balance between urea synthesis and its excretion by kidney. When blood urea is found above 40 mg% in absence of any reason for excessive breakdown of protein, kidney failure is suspected. Third, serum creatinine estimation. Creatinine is a metabolic product of creatine, a constituent of muscles. Its production and excretion in urine is almost constant. Creatinine, which comes into glomeruli with the filtrate, is neither absorbed nor excreted by renal tubule into urine. Creatinine, which comes into glomeruli with the filtrate, is neither reabsorbed nor secreted by renal tubule into urine. This is true if the creatinine level in blood is not very high. If glomerular filtration is impaired, creatinine accumulates in blood. This high creatinine level is a sign of renal failure. Fourth, creatinine clearance test. If you know the amount of creatinine excreted per minute by kidneys in any person, you can calculate the volume of blood which would contains this amount of creatinine. Thus, it can be assumed that the volume of blood which contained the amount of creatinine excreted in 1 minute has been completely cleared of creatinine. Thus, it can be assumed that the volume of blood which contained the amount of creatinine excreted in 1 minute has been completely cleared of creatinine. Creatinine clearance is defined as the volume of blood which contains the amount of creatinine excreted per minute. A diseased glomeruli will filter less amount of creatinine and therefore the person will show low creatinine clearance. Normal range of creatinine clearance in male subjects lie between 85 to 125 ml per minute and in female between 80 to 115 ml per minute. Creatinine clearance is directly influenced by body surface area. Creatinine clearance estimation. First, patient is given about 500 ml of water to drink. This will ensure adequate urine flow. Second, half an hour later, the person is asked to pass urine as completely as possible. This urine is not collected. Third, exactly 60 minutes later, the patient again passes urine as completely as possible into a collecting vessel. The urine is later measured and amount passed per minute is calculated. Let it be V volume per minute. Fourth, just after collecting the urine, a sample of blood of the person is collected for creatinine estimation. Fifth, creatinine level in blood and urine sample is estimated. Let B gram be the amount of creatinine per 100 ml of blood per plasma, U milligram per 100 ml in urine, and V be the volume of urine passes per minute. Calculation. Creatinine clearance is equal to U by B into V ml per minute. Creatinine clearance value when adjusted to body surface area is called a standard clearance. Estimated glomerular filtration rate (eGFR). Calculation of creatinine clearance has become the standard laboratory method to determine GFR. This value is derived by mathematically relating the serum creatinine concentration to the urine creatinine concentration excreted during a period of time, usually 24 hours. A specimen collection therefore must include both a 24-hour urine specimen and a serum creatinine value, ideally collected at the midpoint of the 24-hour urine collection. A specimen collection therefore must include both a 24-hour urine specimen and a serum creatinine value, ideally collected at the midpoint of 24-hour urine collection. Getting an accurate GFR level is challenging because measured GFR is a complicated and lengthy process, and many a time there is improper collection leading to wrong results. This makes it impractical for both clinicians and patients. Inaccurate results caused by incomplete bladder emptying, failure to collect the entire specimen impair the usefulness of this procedure. To overcome this, the timed collection method began to be used as given below. It is for this reason that physicians started to use different formula to estimate creatinine clearance from the serum creatinine concentration, thereby bypassing the need for urine collection. The equation is based on serum creatinine, age, body size, gender, and race without the need of a urine creatinine. Often CKD does not have any symptom until the later stage of the disease. This is the reason why reliable estimates of GFR are so important for identifying CKD and as early as possible. Over the years, different formulas were developed to calculate the GFR. The simplest and most widely used for many years was the formula described by Crowcroft and Gault. C males, creatinine males is equal to 140 minus age into weight upon 72 into serum creatinine milligram per deciliter. Female, result of the above equation into 0.85. This equation had relatively poor accuracy. To overcome this bias, a new equation was generated known as MDRD formula for estimation of eGFR, where the body surface area and if the patient is an African American or not was also factored in. There are various eGFR calculators where we need to know the values of serum creatinine, serum cystatin C, age, sex and race, black or non-black. 2021 CKD EPI formula: sex, female, male, age, serum creatinine normal 0.7 to 1.3 milligram per deciliter, serum cystatin normal 0.51 to 0.98 per milligram per liter. After entering the values, you will get the result after the calculation. The GFR value is of help to the nephrologists in the staging of chronic kidney disease CKD, which help him in planning for the treatment. Stages of chronic kidney disease. Stage 1 with normal or high GFR. GFR greater than 90 ml per minute. Stage 1 with normal or high GFR, GFR greater than 90 ml per minute. Stage 2 mild CKD, GFR is equal to 60 to 89 ml per minute. Stage 3A moderate CKD, GFR 45 से 45 से 59 ml per minute. Stage 3B moderate CKD, GFR 30 to 44 ml per minute. Stage 4 severe CKD, GFR 15 to 29 ml per minute. Stage 5 end stage CKD, GFR less than 15 ml per minute. Prognosis of CKD by GFR and albuminuria category. Prognosis of CKD by GFR and albuminuria categories. Categories KDIGO 2012. Persistent albuminuria categories description and range. A1 normal to mildly increased, less than 30 mg per gram, less than 3 mg per millimole. A2 moderately increased, 30 to 300 mg per gram, 3 to 30 mg mole per millimole. A3 severely increased, greater than 300 mg per gram, greater than 30 mg milli per millimole. GFR categories ml per minute per 1.73 meter square. Description and ranges. G1 normal or high greater than or equal to 90. G2 mildly decreased 60 to 89. G3A mildly to moderately decreased 45 to 59. G3B moderately to severe disease 30 to 44. G4 severely decreased 15 to 29. G5 kidney failure less than 15. Green, low risk if no other marker of kidney disease, no CKD. Yellow, moderately increased risk, orange high risk, red very high risk. Other tests. Many other tests are done to ascertain different functions such as inulin clearance test for glomerular filtration rate, P aminohypate clearance test for renal blood flow measurement, phenol sulfoxafalin test for renal excretory function. Non-biochemical tests such as those dependent upon X-ray, ultrasound, and histopathological studies are not described here for which textbook should be consulted. ओके फ्रेंड्स, चैप्टर कंप्लीट हो चुका है। अब बचा हुआ है अपेंडिक्स।